Your morning checkup is here, this time looking at menopause and the law of all things. Several states are mandating changes to improve the support women get through menopause. Wish TV medical expert Dr. Janel Gordon is here. Good to see you today. Thank you for being with us. Topic that affects everybody at some point in their journey. What are the changes that states are looking to make, and which states have moved on it so far?
Yes, Scott, good morning to you as well. So what we've seen is that several states throughout the nation are looking to improve policy as it relates to clinician training. So medical students who have been graduated and gone on to residency, and even medical students themselves, as well as improving access to care and mandating that insurance companies cover perimenopausal and menopausal care. And we've seen legislation be passed and enacted in several states, from California to Illinois, Maine, Rhode Island, and even Oregon.
Why the need for these changes? What does this effectively do for women?
So unfortunately, for the past 2 decades, we've really had a deficit as it relates to policy, research, care, and even treatment options for women who are in the perimenopausal and menopausal phases of life. And a lot of that stems from a women's health initiative, which was a national study in the early 2000s that showed a link between hormone replacement therapy, or HRT, and breast cancer risk. So what we found is that many clinicians and those who were then training the next generations of physicians like myself were not being encouraged to prescribe HRT to women who were dealing with perimenopausal and menopausal symptoms. So you've had women for the last over 20 years dealing with brain fog, mood changes, palpitations, other cardiovascular symptoms. They've been dealing with sexual dysfunction, and we've just told them, there's not much that we can do about it. Other symptoms that they may experience is decreased bone density, increased risk of fractures. And so now, after further research, just in the last few years, we've realized that actually that link between HRT and breast cancer is not as high as we thought. And the benefits of treating women with HRT actually outweigh the risk. And we still do it on a case-by-case basis.
But many more may be open to it because of that change in thought. Walk us through the timeline. You mentioned perimenopause. Menopause is a moment, right? And perimenopause is getting there?
Exactly, Scott. You have it right. So we define menopause in medicine as a woman not having a period for at least 12 months, so a full calendar year. Prior to that, though, we describe it as the perimenopausal phase, and that can last up to 10 years. And women can start developing symptoms at that time. So now, after further investigation at that data from the Women's Health Initiative, we're saying that women should be treated within 10 years of menopause and no later than age 60 years, because then the risks do start to change from there.
So the idea that you start at least before 60 or you cut it off at 60?
So we need to not start it after age 60.
Okay. I'm learning too. As these take shape, these laws, there's the legislative attack to this. What can women do? Lifestyle changes, things like that, to maximize the good parts of this experience.
Yes, so lifestyle changes are right up my alley. So I would recommend that, one, you see your physician or healthcare team if you feel that you're experiencing perimenopausal or even menopausal symptoms. And then what you can do on your own is, in addition to advocating for yourself, increase your physical activity, especially weight training. So for years, there was this obsession with being thin. And now we realize we really need to focus on being strong for all of us, not just our male counterparts, but women as well. And studies have shown that increased leg strength is tied to better cognitive health and decreasing your risk for dementia. It also improves your cardiovascular health. I'm always going to drive home the nutrition, so make sure you're getting your omega-3s, eating your foods that are going to increase your intake of calcium, vitamin D, get your sunlight, restful sleep. If you're having mood changes, make sure you speak to someone such as a therapist. And one thing that really used to sadden me is when I see patients who are in this phase, perimenopausal, menopausal, and you ask them about their sexual health, and they may be reluctant to speak about it because there's decreased desire, pain, and a host of other symptoms. There are options available to you. Even if you're unsure about the hormone replacement therapy, please speak with your physician. And for our individuals who may carry excess weight on their frame, consider doing a GLP-1 agonist, the injectables that we have for weight loss and even diabetes. And some studies are showing now that coupled with HRT could actually improve a patient's cardiovascular health.
You can almost see these all in a circle and how one affects the other, and if this improves, then that improves, then that improves. And yes. Meanwhile, the states are working on the legislation to make sure the health insurance and the providers are up to speed as well. Doc, thanks for being here today.
Thank you.
Dr. Janel Gordon, our medical expert here at Wish TV.